Hi, we are here with Dr. Michael Ibarra from PhRMA. He is a board certified emergency physician and vice president and chief of medical affairs at PhRMA. Dr. Ibarra, welcome.
Thank you. Thanks for having me.
Yeah, well, we'd love to ask you some questions just to help us get an idea of where PhRMA is in relationship to the HIV epidemic that still is going through much of the South and through the U.S. still. And so the first question I have for you is, PhRMA has been a leader in the fight against HIV and AIDS. Can you talk a little bit about the innovative approach to help end the HIV epidemic?
Yeah, absolutely. You're right. It is an epidemic. It's been almost 40 years that it's really been touching Americans across the U.S. In every state. And you highlighted some of the challenges faced in the South in particular. I'm really proud to work in industry. PhRMA is an association. Our member companies make medicines, innovative medicines like those that are being used to treat HIV. And I'm proud to work in industry because we've been at the forefront of a number of diseases, a lot with COVID-19 right now, but HIV/AIDS in particular over the course of the last several decades. We've been treating patients with HIV/AIDS for 30 plus years now, and it's really kind of nothing short of remarkable that we've been able to make advances to transform HIV, which was once a universally fatal disease, which we kind of feel echoes of today in the current pandemic, living through COVID-19. The fear that people felt at the time when a new infectious disease kind of enters our consciousness. And it was something that we felt very strongly then, something we're feeling now as well. But thankfully, HIV/AIDS is now a manageable condition for many, many patients. With medicines, appropriate therapies, individuals can live close to normal life expectancy because of antiretroviral therapies. Those are the medicines that suppress HIV. And I think we're actually entering an even newer era of medicine for HIV/AIDS. The death rate has fallen about 90% since the introduction of HAART. And we have the ability now to prevent HIV transmission both through PrEP and PEP. PrEP is pre-exposure prophylaxis, and then PEP is post-exposure prophylaxis, something that I'm very familiar with working in the emergency department. Studies have actually shown that pre-exposure prophylaxis, one of the newer ways of treating, can actually reduce the risk of individuals contracting HIV if you take pre-exposure prophylaxis as prescribed. So it's really, really exciting. We've made a lot of progress, and I think more progress on the horizon.
That's fantastic. Yeah, we've been very excited about our new My House clinic because we actually offer PrEP through the clinic with PrEP navigation as well. And so I'm excited to be able to step into that new arena.
Yeah, fantastic.
What do you believe are some of the barriers we still have to overcome in order to finally see a day where HIV transmissions are a thing of the past?
Well, I think it's important to note that this progress didn't happen overnight. It wasn't one single thing that happened that led us to this point. But innovation, particularly with pharmaceuticals, with medicine, it's often a series of kind of small incremental steps marked by the introduction of new treatments as well as preventative options. So we're constantly learning, we're constantly changing our clinical practice. HIV today, in many cases, can involve once daily medications, things that can make it much easier to take the medicine and also reduce the side effects. And so breakthroughs are not just about the new medicine, but also different ways of giving the medicine, different methods of giving the medicine, because adherence is really, really critical. You have to be adherent to your medicine in order to suppress the virus. And so addressing those challenges are really critical. We see potential innovations around things like monthly injections, for example, of medications. When I was in medical school, my infectious disease professor actually had us do an experiment where we all took a bag of M&Ms, and then she told us to schedule a time in the day where you take an orange M&M or a green M&M or a blue M&M. And it was just a thought experiment because honestly, remembering to eat M&Ms at a certain time of day was very, very challenging. And it's a little bit of a silly example because that's just, eating, a treat. But it kind of instilled in us at a relatively young age in our medical training how it is hard to remember to adhere to any regimen, whether it's M&Ms or whether it's medicine. So that's why I think it's important to not overlook these really exciting innovations when it comes to the delivery of medicine. We have to make it more convenient for patients. That's why I'm really excited about the new FDA approvals of injectables for individuals with HIV, which can be administered as as often as once a month. So it's really exciting that we're having these new approaches to be able to treat HIV.
That's fantastic, because I know, I mean, especially for those who are getting older and trying to navigate their medicines, and I mean, I can see that that would just be such a challenge. So I'm excited about that. So PhRMA is our presenting sponsor for Dining Out for Life for this event that we have coming up on April 20th. Why is it important for PhRMA to be partnering with someone like Nashville Cares?
Well, first of all, we so appreciate the work you all are doing. It's really our honor to be supporting the event. The work that you all are doing is, providing important advocacy on behalf of patients, providing services to patients in your area. And that work is really a great example that all of us in the healthcare community should look to and follow. So we're really proud to partner with you all to support the Dining Out for Life event. It's a great event. Hopefully can be in person sometime soon. Hopefully we can get down there and celebrate with you, but we're really proud of the work and the partnership, and looking forward to support it.
Well, thank you. We appreciate you guys, and you've always just rallied around us and make not just the events possible, but make the services we provide possible. So we're so appreciative of you guys. Also, finally, last question would be, speaking to the general population who might not be knowledgeable about HIV, what is the best way that we can advocate for people living with or at risk of HIV?
It's a great question. I think the simple things are probably best. Be open, be honest, be open to learning from one another. I think we all have learned a lot from the current pandemic that we're in with COVID-19, and it's taught us, I think, it certainly taught me that, none of us are safe until all of us are safe. None of us are healthy until all of us are healthy. We're all in this together, I guess is what I'm trying to say. We have to find common ground. And I think that starts with being kind of an open ally, open, honest, listening, learning, and then also doing things like encouraging treatment and support for individuals in the community. So we absolutely appreciate the work that you're doing, and thank you for the chance to support it.
Well, thank you. I appreciate that. Appreciate your partnership and all that you're doing to further just health and community health. It's amazing. So thank you for being with us today, Dr. Ibarra, and we'll be in touch.
Awesome. Thank you.